Hi, besties. Welcome to the Nurse Aspect where we assess and evaluate. I'm your host, Nurse Becca, and today we have Nurse Dawn with us. Welcome, Dawn.
Welcome.
Clap, clap,
Thank
clap,
you.
clap,
Thank you for
clap, clap,
having me.
clap. Welcome. So tell me, why did you get into nursing?
Um, I got into nursing. I can't say it was random, but it was late in life. Nursing is my second career.
Okay.
I worked in the diagnostic world of the medical field. I was an ultrasound tech for 3 decades.
Wow.
For 3 decades,
Wow.
and I felt I've accomplished all that I need to accomplish in that career, and I wanted to still do something, but be with the patients at bedside. And I just wanted a better relationship with the patient, a longer relationship, because an ultrasound is just you're with the patient for about an hour or so. And I just wanted to really make a difference at that point in my life. And I felt that being a nurse would make a difference, and I pretty much searched out different avenues. And
Mm-hmm.
hospice and palliative is, I would say, what I was led to do.
How did you know that?
Interesting story. Like I said, looking into nursing and being in the diagnostic world, I was familiar with different areas of nursing as far as in the ER, as far as I worked in cardiac, OR, but those things didn't really ignite me
Okay.
as far as nursing. And I saw a show. My husband had told me about a show called Time of Death on Showtime,
Okay.
and it was about hospice nursing.
Mm-hmm.
And I was so touched and moved by it because of the not just giving, I guess, the care that they were giving the patients was more of an intimate care. So you were caring for the patient's body, but mind and spirit. And where I was in my life, I was more moved spiritually in my life that I felt that this is something that I can do. And I really felt it was like a divine intervention. So
Okay.
at I would say later years of my life, I decided to change course and go into nursing.
Wow. Was the transition easy for you, or what was the transition like?
It was. I thought it would be easy because I figured being in the medical field for many decades, so this should be a piece of cake. But just because you know a doctor doesn't mean that you can be a doctor.
Yes, that
so
is
so
that is true. That is
that's
very
pretty
true.
much what I learned. Just because I worked around many nurses didn't mean I knew nursing,
Mm-hmm.
and it was a humbling experience, a very rewarding but a humbling experience.
Okay.
Very humbling.
Okay. So you said that you started out in cardiac. So was that
Yes.
your first nursing job?
No, I like I said, being spiritually grounded, I will say, the saying is that when you plan, God laughs.
Boy,
and
boy, is he laughing.
he had a ball with me.
Mm-hmm.
Like I said, I was just soul searched on becoming a hospice nurse, palliative nurse, and I figured if I make it through nursing school, which it was a journey, I thought I was going to make it without a problem, but once I got in, I was like, if I make it through,
Mm-hmm.
um,
Not if.
once I got in, I said, if I make it through, I'm definitely going to be hospice palliative. And that didn't turn out the way I planned
Okay.
because he chuckled at it.
Mm-hmm.
And so cardiac was my background, but I just knew I was going to go into hospice
Mm-hmm.
palliative. So I had bypassed a lot of cardiac jobs that were probably available to me. I
Mm-hmm.
was like, no, I'm not going to do that. That's not what I want to do anymore.
Mm-hmm.
Only to find out that I had to come in pretty much at the med surge level, entry level. So I did that for a year, regular med surge. Then I said, well, let me hone on the skills that I know
Mm-hmm.
until I get my destiny job. And then I transferred into med surge telemetry,
Okay.
cardiac. And I was much more comfortable because I did have a cardiac background.
Okay.
So still wasn't where I was destined to be, but cardiac. It would have been a good second choice
Okay.
to be some sort of cardiac nurse.
Okay.
But
What did you like about cardiac, or what you hate about med surge?
I think my thinking was that being so engrossed in cardiac for over 3 decades, I just blurred out med surge. So doing med surge, it was more of battling myself
Okay.
because I was like I don't need to be here. I know cardiac. I don't need to be here. But it was a blessing in disguise.
Mm-hmm.
It really was a blessing in disguise because as a new nurse, you hone on the skills that you when you specialize, you may not use certain skills again,
Mm-hmm.
and it allows you to learn a little bit of everything
Okay.
and perfect skills that at least you started them, and you may not use them 10 years down the road once you specialize, but still at least you've came in on the entry level, and I was grateful for that.
Okay. What do you feel about med surge helps you in palliative?
Oh, it like I said, it was a blessing in disguise because palliative is med surge.
Mm-hmm.
You just more treating the symptoms as opposed to curative, but you learn how to you put in Foley's, you're changing IVs often, you do have to still do heparin drips. So the basic skills that you learn in med surge make you strong in palliative. And coming into the unit that I'm on, many of the nurses have been in palliative for a long time. Coming in med surge, I'm able to do a lot of things that they may have forgotten
Okay.
how to do
Okay.
because they haven't had it as often. So we still get med surge patients on our floor.
Mm-hmm.
So I have no problem jumping into it,
Okay.
jumping into the med surge patients.
What would you say to someone that's like, oh my gosh, palliative hospice, like, I don't want to be around death. Like, that's like so sad. How do you deal with that? How do you cope with it?
It is. I will say it's truly a calling, and in the medical field, we have to understand that we can't save everybody,
Right.
and that's number one. Number two, I heard this statement, and this is my go-to. 10 out of 10 people die,
Mm-hmm.
so we all are going to die,
Right.
and a person deserves to die with dignity.
Mm-hmm.
I've seen instances on the floor where they call a cold, the patient is, they try to resuscitate the patient, they're not able to, and then everybody walks away.
Mm-hmm.
And that's not a, that's not a respectable, a decent way to die to me,
Yeah. I
you
see what you
know.
mean.
And like I said, then you got to call the family, then you scurrying around, you got to clean the room up. It's just different.
Mm-hmm.
It's just different in palliative, and like I said, it's hard to see, but I think in the medical field we don't have to change the thinking, but we have to have people that do understand
Yeah.
that everybody can't be
Mm-hmm.
saved. So it's and it's rewarding. It's really rewarding, and it kind of changes. It changes you. It changes the individual.
How do you feel like it changed you?
Um, Things are not as you can't take things for granted.
Mm-hmm.
You have to appreciate every moment when you see family members lose a loved one. Maybe that argument you had with your spouse or kid is not that difficult anymore. It's not
Mm-hmm.
that serious.
Yeah.
So it puts things in perspective. Working with these patients,
Mm-hmm.
you're there to help guide the loved ones and give them a consoling word.
Yeah.
Peaceful. Give them peace. Let them know that it's going to be okay if they have any if they're faith-based religion, to have them lean on their religion,
Mm-hmm.
to remind them.
Yeah.
So it's different. It's different, but it's very rewarding.
Okay.
Very rewarding.
It seems like like just from what you're saying, it just
Hmm.
reminds me like life is short. You know,
Life is short.
life is very short, and then of course, yes, we all see things in the medical field, but especially working in palliative in hospice, like it just reminds you of how like life is just so precious, and exactly what you said, like that argument was it really worth it,
That's right.
or sometimes you say things and you're like, I wish you weren't here, I wish you were dead, and like but you're actually seeing that, like,
That's right.
every shift, or or it's something that's like pending, on your shift, and it's kind of like it reminds you like I actually don't wish that, I would not wish that on someone,
Yes.
so it's just it is very rewarding, like
Yes.
it definitely takes a special kind of person to work in that field.
I think it takes a special kind of working person to work in the medical field. Period.
Yeah.
But I guess it ups the ante a little bit.
Hmm.
But it's needed.
Yeah, for
It's
sure.
it's definitely needed. The family members they thank us.
Hmm.
You know, um, it's a service that we don't take the time to really see. I think we do, but like I said, everybody's afraid. A lot of not everybody, but a lot of people are afraid
Hmm.
because say, how can you do this? And I was like, well, how could you not?
Yeah.
Somebody has to.
Right.
Somebody has to. And many other jobs, I could sit back and say, I would never do that. And I would never do it because it's not for me.
Hmm.
Um, this is, I guess those that do this is our calling,
Hmm.
as being in healthcare would be anybody's calling per se.
Okay.
But yeah, it's I won't say don't knock it till you try it, but it is definitely a rewarding job.
Okay.
Definitely a
Well,
rewarding
thank
job.
you for all that you do for your palliative
Thank you.
patients.
All
Your
nurses,
spirit
everything.
is just very calming, very like soothing. You could tell, even like I'm sure a million people would be like, "Yeah, I would want this person to be my nurse."
It's
Like this is you seem very suited for palliative.
Thank you. I don't see that.
What?
I really don't. But I've had somebody, quite a few patients mention that to me, like I'm just me. But that's when you realize there's something bigger than you
Mhm.
driving you
Yeah.
to do this.
Yeah.
So just as you have nurses that are excellent with children and they can calm children down,
Mhm.
and family members, that's their calling
Yeah.
to do that. They may not see that. They say, I just love children, but no, it's something bigger than that.
Mhm.
So, and then that's what we have as nurses. We have to acknowledge at some point and run with it.
Well, I mean, you may not see it, but I can see the gift placed inside of you. So
Well, thank
I'm
you.
just saying, like, I don't think that it's any stretch of the truth when your patients are saying that, like, you
Thank you.
are, very like caring, soothing, compassionate. You could see it. I could see it like radiating off of you. So
Thank you.
yeah.
Thank you.
Would
Thank
you
you.
ever see yourself working in any other specialty?
This is it. I and it's interesting because I'm on a floor where the nurses they're wonderful nurses. They're experienced decades of nursing, and they're moving on to different things.
Mm-hmm.
And I'm like, nope, I'm good here.
Mm-hmm.
You can't. Everybody doesn't have to be a chief,
Yeah.
and you can be an Indian and be just as much of a strong team player.
Mm-hmm.
And like I said, my goal is at this point in my life and my career, my goal is to be there for the patient.
Yeah.
To be there for the patient. There are other people that can be there for the team members and the nurses, but my goal is to be there for the patient. So that's where I'm at.
Okay. I
That's
love
where
that.
that's where I'm at.
Okay. Now, if you could give yourself or any nurse out there any tips, what would you say? Or what would you have to offer maybe like your younger self or a baby nurse or veteran nurse, a palliative nurse, any kind of nurse?
Don't be afraid to ask questions. I find that I'm old baby nurse.
Not old baby.
I still want to be a baby nurse. Um, but I ask questions.
Mhm.
I still ask questions, and I find some of the younger ones, it's you have to ask. If you're unsure, ask. If you're unsure the second time, ask. If you're unsure the third time, ask. Because at the end of the day, it's not about our egos, it's about the patient
Yeah.
and the patient's safety.
Mhm.
And I think you and I have both seen some things that if you just ask.
Yeah.
Just don't be
We
afraid
have
to
seen some
ask. Don't
things.
be afraid to bother anybody about it. If you don't get it, keep asking till you get it, because that could be your mother, your father, your sister, your brother that may be on the receiving end of something that's not safe.
Hmm. And not only that, it's also your license that
It's
you
your
worked hard
license.
to get.
And
Yeah.
it's funny because I mentioned this to one of my superiors, and they did say it's your license
Hmm.
too, and which it is, very much your license, but it's my conscience.
Yes. Yes. That's
Okay, I gotta live with
also.
my conscience.
Yeah.
I'm a person that's had multiple careers, so
Hmm.
I love nursing, but I've had other careers, so it's my conscience.
Hmm.
So you got to put it, because people can say, "Well, I can get another job." No, it's your conscience.
Hmm.
You want to make sure that patient is safe.
Yeah.
So don't be afraid to ask. Please ask.
Okay.
Ask.
That's a great tip. And always that never goes out of style, asking
Yeah,
questions. Yeah.
ask questions. And don't be afraid if you don't want to ask the questions all the time. I raise my hand all the time still.
Okay, listen. If you know what I always like when I was like precepting, I would always like, always try to make it comfortable for whoever I'm orienting to the unit to be able to ask questions,
That's
and
right.
or I would ask them
Yeah, any
questions because I
questions?
want you to be able to talk. You shouldn't be afraid to ask
That's right.
anybody questions, and for exactly that. Yes, your conscience, your license, but at the end of the day, like this situation may come up again
That's
in
right.
wherever you're working. It's better for you to know than to not know, or to act like you don't know.
Yep.
It's super important, and that goes back to like grade school. Like, don't be embarrassed. No
That's right.
question is too big or too
That's right.
small.
That's right.
Ask the questions that you need. Like, no question is dumb. No question is dumb.
Would you be surprised how many they
I am not. I am
so I
not
just
surprised.
so so we just say ask.
Yeah,
Just ask.
yeah.
As many times over ask.
Hmm. I love that. Thank you so much for coming,
Thank
stopping
you.
by. Now, I will say this because Dawn mentioned that she was working for 3 decades,
Uh-huh.
and if you're watching the video, does not look like it at
Oh no,
all.
I
Okay, this is not an
I'm
old
not a pro
baby nurse. Okay, because it's giving young. It's giving. I
No.
have great genes. The skincare is
No,
skinning.
no,
Okay,
no. Thank
glowing.
you.
This is not somebody that's been working
Thank
for
you. Thank
extra long.
Yeah, no, I'm
Okay,
not a prodigy child. I was
listen,
three
if
decades
you
and I
wanna like
started,
on a
yeah,
side note, give people your skin routine, okay? She drinks her water, she prays daily, and it's something else on in there because I'm telling you, the skin is giving.
genetics.
Okay, okay,
I do
genes.
genetics and prayer. I can't
Okay,
even do
that's
the
fine.
water.
Listen, all right, so get you some good genetics and some prayer. That's the tip of the
Just
day.
genetics and
Tip
prayer.
2 tips for the day.
Yes, yes.
But thank you for stopping by. I appreciate you coming.
Thank you. Thank
You're
you.
more than welcome to come back if you ever want to add
Will
anything to whatever you're
will
saying.
do. We
Give any
welcome all.
updates,
If
when you
any,
maybe like are retiring or whatever, and you want to tell us what retiring is like, something like that.
I
More than welcome to stop by.
I don't know if nurses do retire, do we?
I,
We-
I don't know. I can't speak for. I will be
Everybody has a
eventually
side. They seem
retiring
to
from
have a
bedside.
side
It's not.
hustle doing
This is
something.
not. I'm not bringing this to the wheels. I'm not. It's not happening. It's at some point I will be retiring.
Okay. All
I'll
right.
come back and say
All right.
then. All right. Thank you.
Thank you.
Omega